Hi, Dr. Heather here. I know you're wondering, does it really have to be this way with low thyroid? Now, the short answer is absolutely not. Now, typically, the story that I hear from almost every single low thyroid patient is, you're going on through life and usually this whole low thyroid thing turns on after the birth of a child, but it doesn't always get diagnosed then. But that's when we start to have symptoms. So after the birth of a child, essentially the immune system kind of flip-flops so that we can keep the baby healthy, and it doesn't flip back over. And so essentially it becomes an autoimmune issue. Now, some of the symptoms that we experience early on is that we're really tired, maybe we have some depression, we're not sleeping at night, but who can determine if it's caused from this low thyroid thing or from being a new mom? So most of the time this gets chalked up to just being a new mom, your body needs to heal, which is true, and then the days go by and the weeks go by and the years go by. And then you're like, this just cannot be because I'm a mom. I just don't think that this is normal. And so you go to your doctor and you tell them that you have really low energy, you're super fatigued, you're not sleeping well at night, you have some depression, anxiety, maybe you have heart palpitations, the weight is just not coming off, or maybe it's still creeping up, regardless of how much you're exercising and how little that you're eating. So you go to the doctor and you tell the doctor, because we are really good at asking Dr. Google first. So you go to your doctor and you're like, would you please check my thyroid? Because I really think something is off. And so one of two things happens. They run the test and mostly they're running just a TSH. And it either comes back where your TSH is high, which means that you have low thyroid, and they're like, fantastic, we figured it out. You had low thyroid. Here's your thyroid hormones. You're gonna be on these for the rest of your life, and it should fix all of your problems. So you go and you take those thyroid hormones, and for you, you're probably like, okay, if this is gonna fix all the problems and the weight's gonna come off and I'm gonna have a lot more energy and I'm gonna sleep through the night, the depression, anxiety is gonna get better, then I will take this pill for the rest of my life. On the other hand, it can be really frustrating because when you get your test back from the doctor and they say, hey, there's nothing wrong with your thyroid, everything looks fine, would you like an antidepressant? Oh, here's an anti-anxiety medication, here's a sleeping pill, here's a weight loss pill. And so then all of the drugs start to come to mask all of the symptoms that you're struggling with. And even if you take those medications, it's really just masking the symptom and it's not really getting down to the root cause. So you still don't feel right. So you go along and you take your thyroid medication and you go back and forth to the doctor to try to get your prescription right, and you still don't feel amazing. And maybe you feel amazing short term because they've added some thyroid hormone in there, but long term it doesn't usually do the trick. And you keep going through life, they keep increasing your meds, and if that doesn't do the trick, then they continue to add more and more medications over time. And the crazy thing is that as you start to move into different phases of your life, right? When you start to move into perimenopause and postmenopause, then we start to have other symptoms that could be related to all these underlying issues in low thyroid, but they're chalked up to, it's just menopause. This is what happens when you go through menopause. You gain more weight. Most common disease process that I see in my postmenopausal females are type 2 diabetes. So insulin resistance starts long before that, but you don't know because it's not a diagnosable disease yet. All along, the insulin resistance is building, you continue to gain weight, and then voila, when you are postmenopausal, now you have type 2 diabetes. I would probably say that about 70% of my patients or more have some kind of insulin resistance, some severity, whether it's insulin resistance or prediabetes or full-on diabetes, and many of you don't even know. So as we're moving through life, well then now we have diabetes, and now we have cardiovascular disease, And now we're on diabetic medication and high blood pressure medication and a statin along with our thyroid medication. And lo and behold, we have hot flashes like crazy. And so then here comes all of the hormone replacement therapy. So, you know, it's just a really never ending story. And the more and more medications you're on, the more and more you feel terrible. The symptoms don't go away. And I know that you must be thinking, does it really have to be this way? Well, I want you to know that when you have symptoms, it is just your body's way of communicating with you and letting you know that something is just not right. There is some imbalance that's going on underneath the surface that hasn't been addressed. So if whatever you're doing right now isn't addressing these symptoms, then it means that there is still something there. And the body is so cool because you are born to heal. You are a self-healing organism. And so your body is always trying to get you into the best state, and it's trying to communicate with you. It's not that you're broken, it's that you are actually working. And it's trying to give you a signal that you just haven't uncovered what's going on underneath the surface. So I want to leave you with this. I just want you to remember that you are not broken and you are born to heal.